So hi guys, so today we will be discussing about IgA nephropathy, right? What is IgA nephropathy and how it's gonna impact the patient who's been suffering from IgA nephropathy. See, IgA nephropathy is a specific type of disorder where you usually see that the glomerular basement membrane is been damaged. So collectively the podocytes and the inocular areas of the basement and the barrier between the salt uptake, reabsorption and blood circulation either to the upper portion of the body and the lower portion of the body changes. So basically it means to say that the protein, the net protein exchange, the protein hemostasis in the body, along with that the susceptibility for the risk of respiratory infection also increases. Although it has been seen as one of the mimicry of autoimmune disorder, so it is kind of behave in a certain way like an autoimmune reactions to the body. Since it is having IgA nephropathy as a disorder, so similarly IgA, immunoglobulin IgA in some of the ways is being disturbed, right? So what does it mean to say? It does mean to say is that whether the immune cells, and the proliferator cells near the site of the glomerular basement membrane, they've become hyperactive. Due to the hyperactivity of the membrane, what happens, the perforation rate and you can see the barrier consumption rate increases, due to which what happens is that the leaking out of the salt, chemicals and you can say metabolic waste increases. So for that what happens is the net excess waste produced in the blood volume increases, and it could lead to different phenomena. One of the prime example of that is acute kidney injury. So many dangerous manifestations are seen from the IgA nephropathy. That includes AKI as I told. Then the CKD also is sure sort to have with the patient, right? So what we can do is that we can go underlying investigation for the day, for the same, right? After the investigation is done, the similar medication purpose, you can say the course of medication purpose should be taken into consideration. So I would tell you, it is considered to be a rare disease, but it is very prevalent in current scenarios, specifically in Asian nations, like China and then Indian nations also. So typically it's called Berger syndrome also. Okay, its other name is Berger syndrome also. Along with the Berger syndrome, it has been seen to have mimicry the same way like the nephritic syndrome. Okay, so it has a potentiality to damage other metabolites also and form some bone lytic lesions also in some cases. So you need to be aware of the condition where it could be something like that. So being a rare disease, it is a very important disease of concern, so we should have to take care of that. So this is the basic you can have know about the IgA nephropathy. Thanks. We will be discussing more about the slides and the diagrams and the mechanism of actions in the upcoming videos. Thanks a lot.